Hi, Kinesiology 3010. Welcome to our part two of our tests and measurements for physical fitness for adults. Now we're going to talk about muscular strength and muscular endurance. So these are muscle function tests. So we know that muscle strength is the ability for a muscle group to produce maximal force. So think about this as like one repetition maximum. Muscular endurance is the ability to resist fatigue over repeated contractions or maintaining contraction at a submaximal effort or against submaximal resistance. Okay, so we have some field measurements, so we can use resistance-based measurements, so tests of using it against a resistance to test for muscular strength. So maximal strength can be assessed in 1 to 5 repetition maximums, in some cases up to 10, depending on the familiarization of the person that is being measured. So we want to use maybe an estimated 1 repetition maximum from a 5 or 10 repetition maximum because it is much safer compared to a 1 repetition maximum that would need a more experienced person to perform that test. But make sure that we have safe equipment, we're using the right test for the right population, and make sure we use rest intervals before each attempt. So oftentimes when we perform these tests, if we're performing a 1 repetition maximum, we're looking for the most resistance an individual can move within that movement pattern. Okay, so we'll often use something like 5 to 10 repetitions at a 40 to 60%, and then perform small increases. So 10 to 15% increases over 3 to 5 practice sessions. So these are kind of warm-up trials, and then perform 2 to 3 trials at their estimated 1 repetition maximum, and continue to add that resistance until they are unable to complete the test. Make sure that we actually include rest into these. So 3 to 5 minutes rest is required for the body, the nervous system to recover from maximal efforts, from acute maximal efforts. So adding in this recovery time can give us a more reliable and a more valid test of maximal strength. If someone's fatigued, that's going to interfere with maximum strength. If we're looking for muscular endurance, we need to look at a submaximal resistance over repeated repetitions or an extended period of time. Okay, so at 70% of maximum, a normal person can perform about 12 repetitions, sometimes up to 15 if they're untrained. So 70% of a maximum is a submaximal effort, and we're looking at how well they can perform that movement over extended repetitions. Those who can perform more repetitions at a percentage of their repetition maximum have greater endurance. This is kind of more on the strength end of the muscular endurance spectrum. We can also look at things like the push-up test like you did in your lab as a more field measurement of muscular endurance at a more submaximal effort. So using either the standard push-up or the modified push-up. And we often use males perform the standard push-up and females perform the modified push-up. That's where we have most of our norms from, most of our standards. So we know that excellent male push-up performance is above 36 and excellent female push-up performance is above 30 for these standard push-up tests. And we know that if someone is unable to perform 16 repetitions for males and 9 repetitions for females, that they have poor muscular endurance of their upper body. It's likely that the inability to perform at least average on this test shows a limitation in maximal strength of the upper extremity, because a push-up should not be close to 72% of your maximum effort. So if you're down there, you probably have lower maximal strength, which is limiting your relative muscular endurance based on your body weight. So improving strength may help with improving endurance because they do fall together. More strength, okay, more maximal strength can contribute to a lower weights at submaximal efforts, or the ability to repeat even more submaximal efforts. And we can also use the sit-up test. We did the 2-minute sit-up test in our lab. We also have the 1-minute sit-up test from the YMCA, looking at how many sit-ups are possible within a minute. So we're looking at how many repetitions they can perform with a resistance that is relative to their body size, and a set time span for them to complete those repetitions. If you're able to perform more repetitions, that means you have a greater ability to repeat submaximal efforts, or you have greater muscular endurance of the muscles involved in the sit-up, so the hip flexors and the trunk flexors. And when we're measuring flexibility, it has to be it's looking at range of motion at a joint, and it has to be joint specific. So we don't really have a general test that can say you are flexible, because each joint is slightly different in its range of motion available. And you can have differences in range of motion right to left, joint to joint. And we have some other implications, like excess body fat can decrease flexibility because we have more soft tissue structures. We have less muscle mass, which can limit the ability for the body to move. Our best general assessment of flexibility is using the trunk flexion test, which assesses range of motion at the hip and the trunk, so the lower back and the upper back. We did this test in one of our labs using a yardstick on the floor, and then having an individual reach as far forward as we could. We tried to increase range of motion in our lab by using intervention, using that foam rolling intervention. Okay, but this is a general test of posterior flexibility, or low back and hip flexibility for the movement of flexion. Okay, we also have our standard shoulder stretch, which looks at internal and external rotation of the shoulders. So this is how far we can reach over our shoulder and down our back and up our lower back. So we have standards depending on individuals. So if we're able to touch our hands together, we have a high level of flexibility. If we can't, then we have a lower level of flexibility. And that's kind of our check the box, our criteria for shoulder flexibility in this test, within the shoulder stretch test. But different groups have different abilities. If someone has a higher level of body fat percentage, they're probably less likely to be able to achieve this. If you're working or using any kind of overhead throwing athlete, so someone who performs something like water polo, softball, baseball, quarterbacks in football, where they're constantly throwing, they'll likely have limited internal rotation on one shoulder and won't be able to pass the test. So if you have kids who play baseball, kids who throw, and you're working in a PE setting, and you perform this stretch for flexibility, those who are throwing athletes or participate in throwing sports are less likely to pass this test compared to those who do not play throwing sports, because throwing sports increase external rotation and decrease internal rotation on the throwing arm. So that's something to keep in mind if you're using these flexibility assessments. Just because they don't pass doesn't mean that they have a problem. It may just be a change in structure based on whatever they're doing. Okay. And then to test multiple fitness components, we have to create things called test batteries. A test battery is a grouping of tests to assess multiple components. So we have things like the YMCA physical fitness battery. So this physical fitness battery has height, weight, resting blood pressure, resting heart rate, body composition, a cardiovascular fitness evaluation, a flexibility evaluation, and a muscular function evaluation. So we have 8 different components that we know are all related to fitness and health. So we test these as a group to get an overall picture of that individual's fitness. And we also have the Canadian fitness battery. This one includes abdominal endurance, upper body endurance, flexibility, cardiovascular endurance through a distance run, body composition, resting blood pressure, and resting heart rate. So instead of using height and weight to assess BMI, and use that as a body composition measure, the Canadian fitness test battery uses skin fold measurements to actually assess body fat percentage rather than just looking at body size. Okay. With the ACSM, or the American College of Sports Medicine test battery, we have the 1 mile walk, BMI and waist to hip ratio, the sit and reach test for flexibility, and the push-up test for muscular endurance. So this is a smaller test battery, but it's still hitting those major components of cardiovascular endurance, body composition, flexibility, and muscle function. Okay, if we're looking at just kind of a general health test battery, so maybe you're a personal trainer, maybe you are working with different groups of individuals, using something like the 1 mile walk is very capable for most people. BMI in a sedentary population is extremely valid. Abdominal power using the YMCA sit-up test is a great way to measure anterior muscular endurance or trunk muscular endurance of the abdominals. Upper body strength tests using the Canadian fitness test, so using the modified and the standard push-ups, and then using the sit and reach test. So this is a very general fitness related battery. If we can improve performance along all of these, we can have a chance of improving fitness and health for the people that we're working with. Okay, because this is important to start, because as an individual ages, function goes down. Okay, so all of these factors like sensation, mental abilities, organ function, bone mineral density, and physical fitness all relate to a decreased quality of life if we're lowering their performance. So by improving these fitness components, we can stave off those kind of age-related decrements in quality of life. So if we're creating a test battery for older adults, we have to look at some different functions, because based on what they need, it might be slightly different than a younger adult. So physical fitness components that are necessary for older adults are those that are more similar to activities of daily living. So we can use some of the 30-second chair stand that we did in lab, the arm curl test, sit and reach tests, the back scratch shoulder flexibility test. Think about just reaching over your shoulder to grab the seat belt in your car. If you have a lower ability to reach, especially over yourself or behind yourself, it's going to limit quality of life. Use cardiovascular endurance measurements like the 6-minute walk like we did in lab, or use the timed up and go for motor fitness, and use the BMI for their body composition. So we have all of these other components, even some skill components that we can use with older adults that are related to their activities of daily living. Okay, and we need to be able to measure all of these qualities, because we need to know if there is a problem. If we don't measure, we don't know. Okay, so with physical activity and quality of life, if we can measure these functional capacities, especially in older adults, we can kind of send up some red flags, send up some flares if we see some problems, especially earlier in life. If we know those problems are going to get worse, we can address them using physical activity interventions. Okay, so some quick practice questions for you. What are the differences between physical fitness and just physical activity? Okay, so pause the video, write down what you think. Okay, physical activity is a process. Physical activity is what you do. It's your movement that leads to the product of physical fitness, which is the physical capabilities that you have because of the physical activity that you engage in. Okay, that physical activity could be exercise, it could be activities of daily living, it could be job-related physical activity. And the more physical activity we engage in, especially structured like exercise, can lead to improved physical fitness. Okay, so we can think of things as like occupational and non-occupational physical activity. Some occupations require high levels of physical activity. So think about a firefighter, someone who's a farmer, someone who has to be moving, working. It's a part of their job is to move and to lift, move, carry. Those are occupational forms of physical activity. And then we have non-occupational, which is what most people engage in physical activity, because most occupations now have low physical activity demands. So non-occupational could be leisure time activities, transportation, so you're walking, you're riding your bike, household activities like washing your car, and doing things around the house, or sports and exercise, where you're performing physical activity, maybe structured, less structured, for fun during leisure. Okay, Regular participation in physical activity should be a minimum of 30 minutes of moderate activity on most, if not all, days of the week, or 20 minutes of vigorous physical activity 3 days a week, which equates to about 150 calories of energy per day from physical activity, 1,000 calories per week. But if we really think about this, this is not a whole lot of physical activity. This is kind of the minimum standard, the lowest to possibly prevent disease. If you're looking for things like weight reduction, if you're looking for other options of changing body composition through exercise or through physical activity, it requires a negative calorie balance of about 3,500 calories per week to lose a pound of body weight per week. So this kind of exercise is good for maintenance. It's good for just general health, but if we want changes, major changes, we are going to have major physical activity interventions. And we wouldn't know if we're missing these if we don't measure physical activity. So we can measure physical activity through self-reporting methods, where an individual says how much they think that they're doing. We can have activity diaries where they write down all the physical activity they do. Recalls, so things like an interview. Okay. So how much physical activity did you do? What did you do today? And then direct measurements, so observation, and you write down what they did. Using pedometers or accelerometers, you have one in your phone, they're in most watches, they count your steps. It just counts every time you have a vertical oscillation, so something goes up and down. Checks it off, which could be steps, could be movement. And we could use heart rate monitors and look at how their heart rate changes throughout the day, or use electronic motion sensors that looks at where they move throughout the day. And we know that, well, we've set a standard that 10,000 steps per day is considered active, and over 12,500 steps is highly active. Okay, this is a criterion reference standard. So this is a criteria. You have to reach this level in order to fall in this category. Okay, most people are in this low active to sedentary lifestyle. We have less people that are active and highly active, which puts us at a higher risk for a more obese population with lower physical capacities. And we can also use things like METs, which are metabolic equivalents. One MET is considered your resting metabolic rate if you're just sitting quietly. So right now, sitting doing nothing, how much energy expenditure it requires to do that. So one MET is about 3.5 milliliters of oxygen consumed per kilogram of body weight per minute. So it's pretty low. It's low. So think about this, is how much energy you're using sitting here for 1 minute watching this lecture, doing nothing. And we can measure it in terms of basically what it takes for you to be awake. And this is one MET. So light intensity activity is less than 3 METs. Moderate intensity is 3 to 6 METs. So you're using 3 to 6 times as much energy as you would at rest. And then vigorous intensity is greater than 6 METs, or greater than 6 times the oxygen consumption or the energy utilization that you would require to just be at rest. So this is in terms of resting energy expenditure. Okay. So if we use self-reported activities, use MET minutes as your physical activity per minute or your energy expenditure per minute, we can compare different types of activity and how many METs or how much energy is required to do them. Okay, so how many MET minutes per day that you engage in physical activity, you have to multiply the frequency of activity, the time at which you perform that activity, and the intensity in METs that you perform it, divided by 7 days of the week. So this is the volume of energy you are utilizing per day on average, per day, or minutes per day on average over the course of a week. So you could do this with your clients. You could track their physical activity and looking at how often they engage in a certain type of activity at a certain intensity, sum all of those up and divide it by 7 days, and you can get their average MET minutes per day. Different activities and their corresponding MET minutes. So for example, a brisk walk, cycling at a low intensity, dancing, table tennis, shooting around basketball is somewhere in this moderate activity, or 3 to 6 METs, or metabolic equivalents per minute. So these are kind of moderate activity exercise examples or movement examples. More vigorous would be something like jogging or running, performing martial arts, jump rope, boxing, soccer, swimming, things that are more physically active, that require more energy per minute, or more, about 7 calories per minute for 6 METs of energy expenditure. Okay, so think about these as calories utilized. It takes about 7 calories per minute to engage in these activities, compared to about somewhere around 3.5 to 7 calories per minute to perform these activities. Okay, so that's looking at how much we really require. Our resting metabolic rate that we talked about before, and you calculated in one of our first labs, is the energy expenditure to maintain normal functions at rest. So how much energy it requires your organs, your heart, your lungs, everything while you're at rest. And it's estimated to account for about 50 to 70% of your total energy expenditure. Just depends on your physical activity. The more physically active you are, the less your resting metabolic rate contributes to your total energy expenditure. But I would think the most sedentary individuals' resting metabolic rate accounts for closer to 70+% of their daily energy expenditure. We can calculate this using our resting metabolic rate equation, which takes into account your size and your age, and determines how many calories or kilocalories per day you require at rest. So this is the minimum amount of calories you require to live one day. Okay, so now I have a general activity for you if you want to participate in this activity. No, we can't get into groups, but try to create a fitness battery. Use some of these tests from before that we talked about in labs, that we talked about today and in our part 1 lecture. Create a population, look at a population. Maybe it's older adults, maybe it's younger adults, middle-aged adults. Keep it to adults. We'll work with youth in our next lecture. List some components of physical fitness you want to address, and describe why that component is necessary for that population, and how you're going to measure it. Okay. Wink, wink, there might be something very similar to this on your final exam, so practicing might be very beneficial. If you ever want feedback, please send me an email. I'm happy to give you feedback. And that's it for our lecture today, and I'll see you in our next lecture. Thank you very much.